highlight the hard work actually that you as the public have achieved and the projection ahead as we see it. So the first slide is indicative of the social distancing measures we've all been working hard to achieve. And I think we need to congratulate ourselves, but also maintain these measures as we go forward to ensure that we keep control of the pandemic as it is. This slide shows that since February, there has been a more than 60% drop in our use of transport over all transport types, and particularly in rail and tube, recognising that it's just our essential workers who are going to work at the moment, and usage on that is down by 95%. We've had a little blip, if you like, over the Easter period where people have been at home anyway, and those normal levels, excuse me, normal levels, if you like, for pandemic status are now resumed. So I think a lot of really good work, but work that we need to continue. Next slide, please. Again, we usually look at the number of UK cases which have been confirmed. These are reported when lab tests are completed. It may come a little time after the initial laboratory test. And what you can see here is a rise in the cases that we reported through March. And although there is some variation on a day-to-day basis, in general, there is a trend for the number of cases to be plateauing out now. And that is despite increased testing capacity. And that, I think, is reflective of the social distancing measures that we've had, but are also reflected in our hospital data as well. Next slide, please. And this slide shows you the number of people in hospital over the time period since around the middle of March. There's a few dips in this, which we recognise from data collection, for example, around the early phase in April, but you need to look at the general trend across the picture. And for London particularly, it demonstrates not only the very significant amount of work that our hospitals have been doing, particularly around the first and second week of April, but also the success which is occurring now in the number of cases coming down over time. Now, again, there will be variation as we go forward. We shouldn't be looking at specific day-to-day variation, but it is the trend in that period. Equally, you can see that other parts of the country have had slightly different pressures on their systems, and it is really important that those areas continue to practice social distancing so that their hospital systems as well remain fully able, as they are now, with significant capacity in critical care and in normal bed utilisation, to manage all of the patients who need hospital care. Last slide. And then the last slide here is around our global death comparison. Again, this is one which, as a public health specialist epidemiologist, is one which we need to reflect back on many months ahead, in actual fact, because of the difference in the way which different countries and different systems collect data. But we want to be able to show you what is happening in the UK and how that relates as far as we possibly can to other countries. And you can see there are two lines on this one. The UK hospital-only data, this is very robust data which is readily accessible. And you can see that blue line progressing on the right, but we like to think is starting to even out a little bit. And then you will see to the left of the slide a UK all settings data line, which is reflecting the fact that we have a lag, if you like, between our community death reporting and this endeavours to try and display, in line with some other countries' recording mechanisms, how the UK is managing to that extent. Thank you.
Thank you ever so much, Jenny. And I think the first question that we've got is from Hugh Pym at the BBC.
Thank you. Can you comment on reports today that stocks of PPE were allowed to run down in the couple of years